Hi, my name is Nurse Margaret. If you are watching this video, someone who cares about you thinks that you may benefit from cognitive behavioral therapy. Before we begin, please find a quiet location, put your glasses on if you wear them, and if you use hearing aids, please put them in. If you are experiencing low mood, you are not alone. Up to 20% of older Canadians suffer from depression. Many people are ashamed to talk about it or think that it is a normal part of aging. It isn't. It's an illness and it's treatable. Cognitive behavioral therapy is proven to be an effective treatment for depression. Research shows that over 60% of participants notice an improvement in their symptoms. You may be asking yourself, what is cognitive behavioral therapy? Cognitive behavioral therapy is a type of talk therapy that aims to minimize dysfunctional thinking, actions, and emotions. Through a series of talks with a trained therapist, unhealthy behaviors and negative thinking can be identified. Then, the therapist helps us manage these so that we feel depressed less often. Here's how it works. Actions, thoughts, and emotions are all connected to health. We call this the mental health wheel. As we make changes in one area of the wheel, the other areas will change as well. We can change our emotions and feel better by making changes in one of the other areas. Generally, thought and action are the easiest components to change. Therefore, cognitive behavioral therapy will focus on changing these two areas. The goal of your therapy will be to change the actions and thoughts that can push you into feeling depressed. We will learn to stop the depression train in its tracks. Let's see how cognitive behavioral therapy works. Ronald is 72 years old and lives by himself in a house he owns in Point Grey. Ever since his wife Dolores died 2 years ago, he has been a committed volunteer at his local community center. He tidies the center's kitchen, greets people at the door, and organizes the weekly bingo event every Wednesday afternoon. Ronald feels a sense of reward by volunteering, but also enjoys the social interactions he has with fellow older adults in his community. In fact, Ronald has made a few really close friends at the community center. They play bingo together, talk on the phone, and go to the park regularly. 6 weeks ago, Ronald broke his hip after falling on the way to the community center. Ronald underwent surgery and spent 3 weeks in the hospital. Upon discharge, the doctor told Ronald that it may take approximately a year for him to fully heal. Ronald has not been taking the news well and feels worried that he may fall again, so he has stopped volunteering at the community center. He stays in bed, has lost interest in playing bingo, and has stopped phoning his friends. During a recent home care visit, the nurse noticed Ronald engaging in negative actions and thoughts.
At this rate, I can't go back to volunteering. All of my friends will have forgotten about me, and since my wife is gone too, I'll be alone forever.
Ronald starts to feel sad and hopeless. He thinks maybe things won't get better.
I don't want to be a burden. I feel useless. That's why I don't bother calling them anymore.
Because Ronald has stopped calling his friends, he has lost his social support, which adds to his feelings of depression. Based on Ronald's thoughts, emotions, health, and actions, the home care nurse believes Ronald may be suffering from mild depression. She thinks that cognitive behavioral therapy may be able to help with Ronald's depression. Let's analyze Ronald's situation based on the mental health wheel. Ronald has a thought. All of my friends have forgotten about me, and since my wife is gone too, I'll be alone forever. Thought impacts his emotions. He feels sad and hopeless. His thoughts and emotions impact his actions. He stays in bed and has stopped calling his friends. His actions impact his health. Staying in bed delays his hip rehabilitation, and social isolation makes his depression worse. Therefore, thoughts, actions, emotion, and health are all connected to each other. By targeting Ronald's actions and thoughts, cognitive behavioral therapy can help him with his depression. Let's see how Ronald can use this to stop the depression train in its tracks. One day, Ronald started to feel hopeless about his recovery from surgery. He learned in a recent cognitive behavioral therapy session that when he feels down, he should engage in an action that is enjoyable. Ronald decides to phone one of his friends from the community center. This is a positive action. Ronald's friend answers the phone and says, "Ronald, it's so nice to hear from you. All of us from the community center were worried about you." Ronald is relieved to hear that his friends have not forgotten about him. This impacts his thoughts. Ronald thinks to himself, "My friends still remember and care about me. I am not alone." Ronald's thoughts impact his emotions. Thinking about his friends and realizing he is not alone makes him feel happy. Ronald's emotions help his health. He is motivated to see his friends at the community center again, so he works hard to rehabilitate his hip. Ronald was able to identify actions that would help him stop that depression train in its tracks. With practice and the help of his therapist, Ronald begins to feel less depressed over time. Therefore, he will be able to make better decisions about how to care for himself. This video was an introduction to cognitive behavioral therapy for older adults suffering from mild depression. If you are suffering from mild depression, talk to your healthcare provider about how cognitive behavioral therapy might work for you.